want to push the boundaries of traditional patient care and step into the world of frequency medicine? As Einstein said, future medicine will be the medicine of frequencies. The future is here. Welcome to the ANF Academy, located in the heart of Marbella. We are a premier academy dedicated to educating licensed medical practitioners in the pioneering ANF therapy. We aim to optimize neural and biochemical functions in the human body and efficiently pinpoint the root causes of pain and inflammation in patients with various pathologies. ANF therapy aims to increase treatment adherence and allows patients to feel improvements right from their initial session. We aim to bring rapid yet sustainable recovery with ANF therapy, free of invasive methods, medications, and chemicals. The true advantage of aligning with the ANF Academy extends beyond the therapy. Join a vast ANF network of over 1,500 medical professionals globally, passionately engaging and uplifting each other in their shared innovation journey. Grab the opportunity to enhance your clinical practice with frequency medicine and get ahead of your competition before they get ahead of you. For more information, scan our QR code.
Hello everyone, welcome to the new ANF Academy event. First of all, I would like to apologize for postponing this event. I hope that today you're gonna get what you expected, or we're gonna exceed your expectations. My name is Thea and I am your host today, but I'm not gonna be your only host. Today, Dr. Zedan is joining us. Hello, Dr. Zedan.
Hello, nice to meet you, Guy. I'm Dr. Zedan, and I am working as international business developer for the ANF Academy. Please, if you have any questions, don't hesitate to ask in the Q&A chat below, and we have practitioners that they are waiting your question. They are waiting for your questions, and we are happy, and we are happy to introduce you to the team and to introduce you to the ANF Academy. Thank you so much, and have a nice webinar.
Thank you for your words, Dr. Zedan. This event will approximately take an hour and a half, and during the event, we will treat 2 patients. And this time we have a theme, knee issues. So we will treat 2 new patients with different kind of knee problems. Before we start with patients, Dr. Mikkel will introduce you on neurological perspective on knee problems, and then we will start with patients. After that, if there is time, we would like to have a Q&A session. So if you, as a therapist, have any challenges treating certain pathologies, you can always jump on, turn on your camera, and ask Dr. Mikkel directly. We're not going to keep you waiting any longer. So Dr. Mikkel, you can take over.
Hello, everyone, and very welcome to ANF Academy and this session about orthopedic problem when it comes to knee issues. As you all know, if you are professionals and you work with a lot of patients, you are probably standing in front of a lot of obstacles about the knee problems. Many times they come with an MRI, or they come with any kind of issue with the knee, and you try to solve it, but maybe not always really understand what's going on and the influence on the neurological and biochemical actions that is necessary to actually make the patients better. And we will show it live today with patients I never seen before, and we will show you the clinical examination, how it's done, the neurological way to find out the source of the problem. One thing we need to understand when it comes to knee is that more than 35% of all full body pain we can actually feel in the knee joint, because it's an essential joint in our human body. And therefore, it's very, very sensitive because we use a lot of force on the knees and feet constantly. First of all, I think for many of you, frequency medicine is quite new. You probably already use it, but just in a different way. And you're using a lot of tools that actually is frequencies to help your patients feel less pain. And maybe many times you're wondering, why can I not get these long-term results and quick results that I need to? And I will try to explain that in a very short way. This can be done for hours, but I will do it shortly, okay? So first of all, you all probably work with so-called laser therapy. Laser therapy is very effective in many ways, but it cannot create a healing process. What it actually do when you put the laser beam and hit the tissue, it can also destroy the cells and the cell's ability to actually regenerate itself. But what it do is increasing the blood flow in the area, and therefore again, patients can feel better. When we're working with so-called shock wave, it's the same thing. We're increasing the blood circulation, we're increasing the movement of nutrients, but it doesn't affect the cell in any kind of way that create the fusion, and that way can create the healing. If we talk resonance frequency, that is reflecting frequency, is also used in CAT scan, MRIs, and many other things. It's actually sending a frequency that reflects what we have in the body, because the body's different temperatures and stuff. We can image what's happening inside the body, but it will not affect the cells or anything else that create the healing. Because what is essential is that what science say, we need to have something that can increase the neural oscillation and also work as the nerve system itself. We need to have an action frequency. We need to have a returning frequency that confirm the results we have to be able to create a fusion. When we talk about ANF therapy, that's exactly what we do. As you know from the nerve system, that with a positive and negative charge, we're using positive and negative devices. The positive device is sending out, if you see the blue wave, a very intense and very quick so-called action frequency. And this frequency is actually checking out what's going on and what is the problem. It goes to the negative, that then is what's called the return frequency, that is confirming everything that is in this waveform is totally different from the action frequency. When it hits the positive device again, this wave will change to a different action and create fusion between cells. And this is why we develop long-term and quick results that we will show you today. We will move over to another picture over here, if you follow me. We will look into the knee today as the orthopedic problem with knees. That means we need to check and try to find the source of the patient's issues. It means we need to clinically examine the tendons. We need to locate the main nerves, and also we will turn this around. Examine all the tendons that is connecting the knee with the lower limb, and also maybe up, because you can feel 34% of the problem in this area in your knee. It can still mean it comes from below or it comes from up. And that's what we need to figure out. So we have 3 different patients where we do 3 different protocols. So you can see the different way how to treat this depending what you want with your patients. Now you go over to my colleague here.
Hello, everyone. This is Irina Heini-Suo, ANF Academy Manager. I'm here today to help you understand a little bit more about the ANF therapy method and what we are doing as a tool to help healthcare professionals to approach many different injuries. In the case of this webinar about knee pain. Today we have with us Douglas. He came to the ANF clinic for the first time.
Yeah, first time, yeah.
Yes, yeah. And he's going to now explain to us a little bit of what is going on with his knees, or how can we help him. So here with you, please. Douglas, if you can please explain a little bit what has been going on.
The both knees are worn through sport over the years, and obviously I find it hard to walk long distances. And it's on the interior of this leg, the pain, and this one you can feel crunches when it's moving. I've had treatment and obviously physio and everything, but it doesn't seem to have solved the problem. And I've been trying to do everything but have an operation.
Good thing. Is it any movement you can do now that give you pain, like squatting or anything?
Yeah, squatting I can do, but it's painful.
It's painful.
Yeah.
Can you show me, please? So there, it starts to hurt there?
Yeah.
Okay. Can you go deeper or is it stopped?
No, stop.
It's stopped?
Yeah.
Okay, so we will probably will see that. Okay. So if you're walking a little bit back forwards then, please. Yeah, so we can see it's a lot of extension problem there, for sure. Okay, please. So what we can see on this patient, just a limited squat, is a limited range of movement. He cannot fully extend the knee when walking. That creates an imbalance and probably a lot of pressure on the hip and the lower back as well, which we also could check. But of course, we will start to check his knee if you lie down. To the other side here. So we can see the confirmation here that this knee cannot fully extend. I will put some pressure here. Is this pain, sir?
Yeah.
Okay. So this is pain, and we can also see when I keep the pressure, we can see it's getting bluish and the weakness in the adductors. So we have many things here. This probably have been, I can see it for a long time. Also the color of his leg, that we have a lot of negative blood circulation, probably a shin splint issue, for sure. That was also painful. Sorry for that. And so we need to work with this and see if we can get these patients to extend his knee better. So here is totally stopped. I will not push further because then he will probably hit me. But when we do the clinical surgery here with your hands, we actually need to go in between and feel every single tendon to find out how bad it is. But most important, what strength of the device should I use? Because we have more than 300 different devices that can be used for different kind of deep level pain and inflammation or whatever I want to do. So I will start to check in, okay?
Yeah.
So I start like this to feel on the tissue, and already here I can feel a bump in his leg. So here he has a problem with sartorius for sure. And then comes the weakness. I check in between the adductors. You go in between. And this is also pain, as you can see. So, and this is very light pressure. This is absolutely no hard. Go down to the upper part of the knee, and you need to feel gently and slowly work down. And you can see he start to pull away. So everything I touch here is sore. All the quad tendons as well. And we can see weakness all around. He lost a lot of muscle in this leg. We rotate a little bit so we come more to the lateral side. And it's a lot of water retention here, a lot of edema. All this is water, so this means he has a chronic inflammation for sure. Which explains also the coverage on the leg, that we have a negative circulation. We checked ITB. Everything here is pain for him. Even here. And now you can see the edema here, if I keep pressure here. So here I can suspect also that it's been inflammation for so long time. So we also have the skeletal cells is affected, which will mean the nerve system will try to fix and produce more skeletal cells that will give calcification and inflammatory response. Okay, can I ask you to go on the stomach, please? We will look also on the backside for any visual signs. And we go and check all the tendons here as well. All of this here is edema. And here in the center of the knee here, we have a lymph node here. that I need to control as well, because that itself can give him a lot of pain. Continue. So it's very important when you learn this, what we go a lot up in is to really understand the clinical work and have hands-on. Because one thing is to treat the symptom, and another thing is to treat the source and find the root cause of the problem, but also to understand what else do I need to do, because remove pain can be easy, but I need him to get better. And we check the other knee as well. And here is pain again. So I'm just following the main nerves here. And they are in between every tendon. You find the main nerves, and they tell you a story immediately. Also, when I actually put pressure on the lymphatic here, which gives a lot of pain, I can see a contraction in the muscle here. I don't know if it's visual to you guys, so that will probably tell me I find another problem here. And there it is. So he has a strain here, a damage in the muscle. As you can see, it's going very deep down and a lot of swollenness here.
How does it feel, the examination, Douglas?
What did you say?
Sorry? How does it feel?
Yeah, painful.
Painful, okay. So if you turn around again, Douglas. And on your back, please. So I'm going to start to use the lowest of the frequency. This is so severe case I could actually use stronger devices. But just to show you guys that even the lowest frequency that works more superficial, depending on the placement, can be very, very effective. So we do the retesting again, and we can see he doesn't like this. So this is also for you guys that work with arthritis or osteoarthritis, a very efficient way to help you to rehab these patients, to open up the joint, to increase the range of movement as well. So we will show that with other devices, how we place them with energy devices to increase the elasticity in the muscle and open up the joint, so you can, by manual work, extend the knee again. I had another patient, a similar age as this gentleman, that have this problem in both knees, and he didn't want to have any kind of surgery or whatever, so he asked, can we help him? And we opened up his knees, and today he plays football for the veterans like crazy. So I will use, this is a positive device. I will create a so-called cross protocol. I want to cover all the issues here. So I'm going to put a positive over the knee here. One in the middle of the kneecap. And one below. I'm going to have, yeah. I'm also going to put positives on the medial side. And then when I retest the patient, I examine him with a lot more pressure, because now I really want to go deep into the leg. And you can see already now, I just put the positive, you can see the swollenness around the kneecap already start disappearing. You can see here's a crater, here's another one. And here on the outside, it starts to get another one. So you will see slowly that the knee, if you saw how it was before, that it was very swollen, like a big ball, how it now starts to get reshaped as a real knee.
Now it comes the negative device.
Yeah. So this is the negative device, as I talked about before. This is the one that confirming that here is a problem. Here, these resources is local, and this is what we can work with. So the nerve system will immediately pick up this correction frequency and start to remove active inflammation or problems. So if you take a close look, you can see now how the edema in the leg disappeared, the crater here and here. on the medial side here, and you start slowly to get the shape of a knee again, and only using anti-pain and inflammation things. Because as long as you have an inflammation, the body cannot heal itself. It's impossible. You need to stop this process immediately. Even if we learn at the first stage in the immune response, the inflammation is protecting us, increasing the blood circulation, moving the tissue, which is correct. But if the body doesn't have resources, can remove it fast enough, it will become a chronic issue, as this gentleman, as we can see on his leg. We can also see the color on his foot is less black than before. So something positive is happening immediately. So I will retest again and see if the flexion just with this is better. Are you ready, Don? Or not? Okay. So this is the pressure from before. How does it feel?
Yeah, bit better. Yeah.
Bit better?
Yeah.
Now?
No.
This work. Relax. Take a deep breath. So he's struggling. It's hard. It's painful. Yeah. So with 200% more pressure on the joint, he felt pain, the level of pain that he felt immediately before. Now I will use the antioxidants device. So the AOs, the biochemical antioxidants of carnosine and glutathione, is actually a fusion by thousands and thousands of fragments of history the body collects to fight toxins, bacteria, mutations of cells, free radicals and everything. This is nothing that can be produced artificially or whatsoever. So we have carnosine that is the body's natural anabolic steroid, but also improve the cell dividing and renewing of cell and many other things. So this one, which is essential for healing, low of this can also give IBS and many other problems. Glutathione ADL is produced in our liver. This is the antidote for many things. This is the reason you need to have a healthy liver, because if your liver is not healthy, you have low glutathione, I mean you have severe risk for autoimmune problems, not only orthopedic. So I want to remove the free radicals, which I use with glutathione, and I just place that in between here, and I put a carnosine, renews it, and I put that exactly in the joint line here. And then we just wait a little bit. Normally you wait maybe 5-10 minutes, but I'm very patient, so I wait seconds. But of course I know how fast this works. Then I will have also the frequency MC is an anti-stress. I want to remove the stress in the problem. And I will probably use to put that behind the knee in this case. Because I want it to be able to work, I will explain shortly. I put it just in between here somewhere. What is interesting here now, what you need to understand here, it looks very simple. You're placing these devices here, it looks good, but now it's taking action as really advanced biochemical function. Not only you need to understand how do I want the frequency to penetrate the problem. If you can see now his angle of the knee that was like this before is slowly going down. So the extension is slowly increasing. So now the frequency is not only going from front to back, it also circulating, working together with each other, cross like this, like this, like this, and like this, and actually taking action in the whole joint. And it's getting really warm here. So I will try again. Are you ready, Donald? Yeah, it's good. He volunteered for this. Okay, so now I can see this flexion is increasing. So that means when it can increase so much in so short time, like 10%, I could easily work with him manually and make him during time to have a full normal extension. I will now use the energy device, because why do I want to do that? Let's say like this, you have a patient, you want to do rehabilitation, post knee replacement, or like him, and you want to help him to not only remove the pain, but also to work with him to increase the flexion and opening up the knee. So we have the energy device. I call them energy because what this device is doing is not only working with all the energy sources we have in the body, but it also stimulates the free radicals. And free radicals normally is negative for us when we talk biomedicine, but also positive by activating the protein in the muscles and stimulating them and adrenaline and increase the muscle function, which is really, really important, especially for athletes. So I'm going to create a neurological brace here. With this, I put positive 4 over the anti-inflammatory. So I create just a ring here on lateral side, medial side, posterior, anterior side, just in between the middle of the leg. The negative, and these two exactly, they need to confirm each other to activate these energy sources. And I put this below here. Also on the lateral side, and also below. So if we keep this leg up to each other, you can see, if you noticed before, this was extremely much higher than the other leg. Now it slowly starts to get lower. You feel okay?
Yeah, yeah.
The patient can get dizzy, get iron taste in the mouth, and a little bit of freezing, because these are very, very powerful devices. I will try again. Relax. You okay?
Yeah, yeah.
You're wondering how much he's going to do this. No. So I do slowly. Just try to relax. Try to relax. So you can see the flexion is increased. I just do this slowly. Is it okay? You handle the pain? Because this one, what I do now, would be impossible before. This will hurt so much. Try to unbend the knee a little bit. Oh yeah, that's the worst. Because when we extend it like this, when he's not used to it, so all the muscles opening up slowly. So actually, when you take the knee back, it can actually feel worse than the other one. And stretch it out. Try to push the knee down. Tighten the muscle. Good. Take it up again. Good. And down. Relax. Okay. These I'm very happy with what you will see now. The only thing I have now, I also want to increase the blood circulation in the knee. Because this is, of course, essential. I want to move as much resource here. So what this device is doing here now is sending in correction signals to the nerve system. They're getting activated by the body's infrared heat and the existing neural oscillation that is in the area. And when that is happening, the nerve system have no brain. It will pick up these frequencies immediately and start to copy paste, because the nerve system cannot think. It can only do what's here existing. This is why the whole human development is actually copy paste from mom's neurological function. Because I used to say, that's why very often girls never agree with the mom, because they are the same. So this is what's happening here now. So I will use the device for nitric oxide. Nitric oxide is essential for us. It exists in the lining, in the vessels and veins. It needs our cholesterol. It needs a lot of other resources and oxygen to be able to create the fusion that increase the vasodilation and move our blood around. Because you can see, if you look at the color on his leg now, it's getting more and more white instead of, as it was bluish black up here, it starts to get less and less. So I want to improve this. So I'm going to put nitric oxide over here behind the leg. You follow the order and the blood flow below. Because for you guys that don't know, the second heart of the body is our calf muscle. It helps to pump the blood up. And this inflammation will prevent it. And if the blood cannot come up from the legs, it can create chronic inflammation here, as you can see, as this gentleman have. And that means also in the end, it can create neuropathia and other issues and numbness in the feet and severe pain. So now this leg looks really nice compared to the other leg. Okay. You feel okay, Donald? Yes. You don't regret you came here? No. Okay. So try to relax for me. Just relax. Don't worry. Very good. Okay. If you stand up and walk and see how it feels, please. Yeah. You will get it stiff after I try to relax and just focus on what is possible. How does the leg feel?
Sore,
Yeah.
but not pain.
Yeah, it's sore after I had the extension.
Yeah.
But no pain.
Not so much, I don't. Just aches.
Yeah. If you try to go down to a squat, hold in the back. Well, that's more deeper.
Yeah.
Yeah. How does it feel for you? It feel better?
Yeah. It does.
Mm-hmm. So the soreness you can feel now, of course, when you work with the manual work and extension, because the arthritis is, of course, feeling very weird. And we use the very low frequency here. We can use a much stronger. But if I remove 100% of his pain and he doesn't feel pain, he will also start move as he doesn't have an injury, which can mean he is an old football player. He'll go out and play football and make this problem even worse. And the good thing about these devices and the therapy is I control if I want to remove 10% of the pain, 50 or 100%, depending on the injury and the patient I have in front of me. So in his case, when I see he has this like 30, 40 degree angle and calcifications, I would never remove 100% of his pain. Because the reason is the muscle has get used to have this angle, so they are too short, and the risk for overextension and other muscle injuries will be a problem. Normally with this patient, I will also control the adductors, the lower back. I will check the calf more and see is it any other injuries that I need to take care of, and I will do it at the same time. So we will see what we find on the next patient. And for you, Douglas, make sure to drink a lot of water now. The more water, the better the device is working. It can be now, because when you have this angle you had on your knee when you came in, like this, all your muscles here is weak. Now, the less pain you feel, you will start without thinking to walk more and more natural.
Yeah.
And that can give you training pain. So that pain can feel worse for you because it's a different pain than you're used to. Okay.
Right.
So, but definitely I recommend you to come back so we can work with your knee and open it up. Yeah. Now I use low devices because when I see these alpha experience, I know if you don't feel pain, I know what you will do, but you don't, but you will do it without thinking. It can be a little bit sore now because I tested the
I've had other treatment on the knee.
Sorry?
You know, I've had other treatment on the knee.
Yeah.
One of the clinics I went to, they had this contraption which obviously they tighten up to straighten the.
Yeah.
But it only worked for a while. I did it for a year.
Oh,
but afterwards it went back to the.
I guarantee if you do this here, it will be very good.
Okay.
Yeah, the other patient I talked about was much worse, and this.
Chris.
You can see now when you know Chris? Yeah. He was much worse.
Was he?
He know the patient I talked about. Yeah, big time.
This leg is obviously the colouring is from an injury, from a shin injury, you know.
Yeah, but this is also like
they did a pigskin. That's pigskin on there.
Yeah.
To recover it, you know.
Yeah. But we will take. But you see the colour disappear on this leg. Eh? You see that? And then you have a kneecap now, you did it before. Different. You see that? Yeah. And this is amazing.
Does this work?
No, as I said, what it does, every single one have what's called neurological frequency, the frequency that can create fusions between cells. So, and this is why it works, because it's getting activated by your body's heat and using your resources to heal the body. So when we apply that, we actually take control over the nerve system and moving the resources to this area. Because when the body have tried to fix this for a long time and it doesn't help, and then it gives up and say, okay, we cannot do anything more, and move the resources to your life support components. Now we tell you to fix here, and now for the first time, I guess in a long time, you can see you have a kneecap again, because it was very swollen. It was very easy to see where you have the problem in your knee. Okay. But also now, because you had this angle on your knee for so long time, you have also compensated with your hip, so it will feel weird when you're walking now.
Yeah. Cool. I've got a medal here.
Yeah.
Already, yeah. 20 years. I've got a medal here.
Yeah.
It's been good.
I'm very, very grateful you came here, and we will talk to you outside and how we can continue this for you. And then we take the next question. You see here how all the water disappears. You see this? Yeah, it's moving. I don't know if you can see this on camera, but you can slowly see all the edema disappearing. So he will, we can let him be outside for a while, and then we can see how he feels in a while. He will probably run around in the garden. If you stand up for me, and try to straighten his leg out as much as you can. If you stand on the side so you can see what it means, on his side, not my side. Turn this way, please. So, and stretch out the leg. And I think all of you can see the difference in very, very short time. How much straighter his leg is and how much more normal the leg looks like, which is really amazing to work with this. So this means that to do a full rehab with him will be very, very effective for all of you guys that's looking at now the physios that have this problem. And you want to do rehab with your patient, you can remove the pain, increase the row, and create a massive, better rehabilitation result that sticks. And not like you said, you've been 1 year in one place and it stays for a while and then go back. This is the difference. Okay, thank you very much, Doggy. Douglas. Yeah. So you know Chris, that's cool. The only problem with Chris is his team is Chelsea. Right. So if you go out,
Thank you very much, Douglas.
Thank you.
All right, so this was an example of what ANF therapy can do for a patient with knee pain. So Dr. Mikkel did an examination. He found the areas of inflammation. Just a second. Dr. Mikkel?
Yes.
Yes, because of the microphone, where everybody is
sorry.
So we're in two places at the same time.
Sorry, I forgot.
No worries. So Dr. Mikkel did an examination which is essential to create a protocol. Based on his assessment, he decided to create a protocol for osteoarthritis in the first phase, the first stage of the treatment. This protocol is going to change probably every week, working with higher frequencies to reach deeper tissue layers. So maybe you're wondering if this tool is for you. Of course, if you work with patients with osteoarthritis or any other musculoskeletal or joint issue, this is for you, especially if your patients are struggling on that therapeutic exercise. For example, Douglas could not do a proper squat. If you apply the ANF device, it can help you and your patient to achieve those goals. So we are now waiting for the next patient. We can see what is coming now. Come with me, probably here, waiting for the next. Yes. Hello. Now, come in, please. So welcome to the ANF clinic. I'm sorry, we'll just change the paper a bit. So your name is Napoleon, right? The first time you came here to the clinic?
The first time.
Okay, and you got some knee pain, right?
Yeah, I got some knee problem.
Okay.
It's a bit long.
All right, so today what we are gonna do is that Dr. will check the knee, we'll do an assessment, and we'll apply the ANF therapy method. For that which is new, he will explain to you what is it about. Okay, please have a seat.
Do I have to remove my back or?
That's okay. If you feel comfortable, you can just sit here or just leave your stuff on the bench. So while he gets ready, so maybe you're curious about how to get enrolled. You will get some news at the end of the webinar or maybe during. So we can, you can learn ANF therapy method at ANF Academy. You will learn how to do the examination, how to create a protocol, and how to achieve those results. The devices that Dr. Mikel is using today are included in the first 2 levels of education, so you don't have to wait much to get those results. Yes, please.
Okay. Nice to meet you. What's your name?
Napoleon.
Napoleon. Oh, I like that.
Just call me Nap.
Nap. Okay. Thank you for coming. And you also have a knee issue.
Yeah.
If you lay back, please, lay back. Is it this knee? Is it this knee?
Maybe he can explain.
And recently this left.
This one?
This one also, but this one is worse.
This is worse.
Yeah.
Okay. Well, I like the worse. So if you sit back and put your feet up. Okay.
Good. Should I leave here?
Yeah.
We can do squats for.
Yeah. Okay. So is it any movement you do that provocate the pain? If you do squats, or when do you feel the pain?
When I do squats, and then I could hardly stand up again.
Okay. Can you show me, please? Can you do?
Especially if I sit idle for a while.
Yeah. How deep can you go? Do you feel pain now? And then when you raise up?
I could hardly raise up.
Oh, I hear a good crushing.
Yeah, all the way down. I could hardly.
It's hard to get up again.
It's hard to get up.
Okay. Please go back a minute. So. Okay. So we have, as you can see, not so visual as the other patient, but it can be definitely some kind of hidden problem. We see also he has a little bit of cowboy leg that create a lot of pressure on his knee. So we have a lot of imbalance in his knees that probably give him the pain, because this means probably he walks like this, and then you have enormous pressure on the lateral side and the medial side trying to compensate because of the way he's constructed. And that we cannot do anything about. That's the way how we are. But we will see what we can find. So we could do the same. We're checking everything here, and we have, of course, adductors weakness here. So this can actually be, his pain can be adductors. We're checking the pads here. Yeah, this is a lot. So actually the fat pad here is damaged.
Oh.
This is why people come to me from all over the world. If you have anything, I find it.
That hurts, really hurts.
It's good. And how about this?
Not much as the first one.
So this is worse. Oh, that's bad. Okay. So here we now need to understand, when we find the pain, how is this happening? What is the process here? Is this the primary, or is this because of a long term? Is it spreading and destroying the pads? So we need to check everything here. We start with sartorius. And this is very important because it goes all the way up to the hip. So you find the tendon here. Oh, and that is pain, because all of this weight goes here to stabilize this. And of course, with this, it will give him a lot of pain. So we check here. Moving up, follow sartorius. Yeah, and the structure I feel on the muscles here, on the tendons, is like bulking. So it's actually a chronic issue here. So we go in between. So I go not on, I try to search in between because I need to locate the nerve here. And then I can push the sartorius here a little bit. And here comes the pain. Yeah. Oh, ouch. I work away around. And I always say to the patient, when you do this CST, clinical examination, the examination can hurt. I used to say it's like surgery without any anesthesia or any knives, because you go in between and you try to locate the nerve, because the nerve never lies. So when it's like pain like this, you know you find a severe problem. And then I'm start to think of what protocol I need to do. And also here, the patella ITB. We go all the way around here, so you can see how I work first superficial, then I let the thumb work deeper and deeper. You can see now I'm coming deeper, because what happens when you learn this clinical examination, this is the only place you can learn it, is that when you attack the functional nerve, everything tries to run away. Oh my, it's like an immune response, and everything gets so easy to examine. Continue here to the joint here. Move the kneecap, keep pressure on it. Okay, so a little bit of patella formalis syndrome as well. You still happy you came here? Yeah. Oh, that hurts. Yeah. If you turn around, please, on your stomach. Okay, so we're going to check everything behind. Because he has this inflammation in the front, you can relax it. I'm going to go deep into the joint here, in between the tendons. Locate the lymph node here, and that is fine. Now I'm down into the capsule, very, very deep down, as you can see. Hamstring tendons, hook them, pull them. Here too. Then I need to check his calf. Is it spreading further? Oh. Yeah, it is here. This one. Okay. This leg is differently. Here we have chronic muscle inflammation. The joint works quite well. So I will do a different protocol to show you a different approach of this kind of injury. I have one main injury here, actually. It's a really bad muscle strain here. There we have it. And this is light touch. If I would go deeper, it will probably screen to remove. So if you give me the positive and negative, please. So I will isolate this injury first. I use the same low as you have in AP1 education here. So this is always important here, is to understand the methodology you need to do also to have long. So I put the positive here. And this is right under the joint line. A positive here. And a positive here. So I'm going to isolate this injury so that can heal. And now you see the same here. You see the crater, edema disappear, muscles start to have action immediately. And I put negative here. In the middle of the belly, we also have the aorta and everything here. And here. This is the fun part, because it's really important. Even what we learn in medical school and everything, we should not create pain for the patient, but we need to find the source, because what we teach here is to understand the source, not to treat the symptom or referred pain, but to find the real reason we have a problem. So now I only have pain inflammation. I will find the injury here again and go 3 times as hard directly on the problem, and a little bit of branching, but of course now, but no as before. I'm going to apply now the antioxidant glutathione to remove the free radicals that create the issue. And that one I'm going to put close in between these two, but you see like a triangle, so you can work like this and up and down, okay? I'm going to put the carnosine on the other side here, another triangle and another triangle here. So now it works like this all the way, and look what happens to his cuff. The question is now, is this the source, and how much better is the front of the knee, because it's the same nerve, it's the same branches. Because we need to understand is our nerve system is the main system. It controls everything. When we talk about aging, we talk about optimizing organ function. As long as the nerve system's oscillation can be kept at maximum power, you will not get older and you cannot get sick. Because then your immune system, if you provide your body with the correct resources, right food and water, it can actually heal itself constantly. As soon as we are missing out on this, it cannot. It will missing a lot of resources. Okay, now, okay, so I will put 1000% pressure on your injury here, right? You ready? Are you ready?
Yeah.
This is how fast it works. Okay. If you turn around, Vincent, on your back. Okay. So I go directly to this pad here that was extremely pain, just to control, is this now affected because we have the femoral nerve, everything is branched, is this better? And it is not 100%, but a lot better. So we're going to take another pain inflammation. Because of the patellofemoral syndrome, I'm going to do a little bit different protocol here. I'm going to have a positive here, right on this pad. I'm going to have a positive right over on the joint line from the patella here. I'm going to put a negative on the other one and a negative here. And we're going to remove the stress here by using the frequency of medical cannabis to calm down the stress in this knee. Like this. And we'll wait a little bit. Oh, this is much better now, huh?
Yeah.
You don't feel pain here now. No. And this is interesting because I didn't even treat his ITB. I treat his injury in the calf. And now, before when I did this, he was screaming, as you can see, you have it on video. And now nothing. Are you falling asleep? Okay, so I'm going to take this again. Are you ready? Because now I'm going to use 100% more force with my thumb.
Okay.
Okay, ready?
Ready.
Is it better?
Yeah, I don't feel that much pain the first one.
No.
Ow.
Good. So how can we now make this better? I have this positive and negative here. I have positive and negative here. And I want just to activate also the sartorius and remove this problem, but also here, and so it can work with the whole knee. So one thing I didn't apply yet is the blood flow, which I will do later. But I will take one positive here on sartorius, one on the ITB here, even if I don't need it. It's just to show you guys how you systemically can work with this with different. You can isolate only this if that's the source, or if the ITB is the source, like ITB syndrome or whatever. But very often it's very important to check the sartorius, but also the adductors, because that is 80% of our knee patients is the same. So now I just remove here because we want him to function better. Okay, now I will apply the blood flow and nitric oxide, so we will increase the circulation. And that I do behind here, put the blood flow here. And nitric oxide I will put actually below here. I want it to circulate as much as possible in this area. Oh, yeah. It got extremely much softer. So now you can see how easy I can check all the details here. There's no resistance in the muscles anymore. And what that also tells me is that the inflammation been for so long time, so actually the muscle need to be strengthened to be able to fixate and hold the knee here, because if that inflammation will continue, it will put more and more pressure on the joint itself and create in 1, 2, 3 years extremely problems for this man. So we take this, you can see also here now how the fat pad here, the difference, both sides. This is violent, no screaming.
No.
It's different, huh? It's weird, huh?
How did you do that?
It's like magic. If you stand up and squat again and see how this leg feels.
Okay. Oh, it's better. Yeah. Incredible.
And now we cannot stop squatting.
Yeah.
How do you feel the difference?
There's a really big difference. I can easily stand.
Yeah. So there's no pain when you come up again?
No.
No.
No pain.
It's nice, huh? Like if you lie down, I will show another protocol on the other knee. So from a troubled patient to a happy patient. I will show you another protocol on this knee, just for an example, what you can do if you have a weakness and you're afraid of compensation injuries, because this was this have compensated a lot during time. And that means when this getting better, then this started to be sore, because the nerve system can only register one problem at a time. So when the primary pain is gone, the secondary comes. So if you give me the energy, please. So, and positive. So I will show you a little bit interesting protocol here, how to do this. So I will actually use the energy positive. As we did with the other gentleman, I will put like 4 of the positive here. This. And I want this to be actually an anti-inflammatory protocol without using only pain and inflammation or everything together. So I use the positive energy, and the positive anti-inflammatory. So why do I do this? because by using this stimulates the release of energy, but because this also is anti-inflammatory, they can actually helping each other in an amazing way. And you can put the positive pain up here. Now I just put it below, just to show you. And then I can take the antioxidants. This is a very simple way. This is increasing the energy release. Given anti-inflammatory, it's not the same effective as you use 100% pain inflammation, but because this is higher frequency than the other, it can also become like a negative to this one, and you can get two function, not the same high increased function as they are independently, but it's a way to do it in a later stage of treatment when you go to so-called healing process. I use the antioxidants, the glutathione and carnosine over the joint line, one on each side, so they can work together with all of these. And an MC I had somewhere, I will put in the middle of the kneecap, like this. So try to do your squats again, please.
Far more better.
Different, huh?
Yeah, it's better than with this one.
Yeah. It's weird, huh? Especially when you're expecting the pain and it's no pain. So this is how to show you guys. You can do like, actually, if you see here, we're treating patellofemoral syndrome, a little bit like Osgood-Schlatter or like fat pad, the injury. We're treating the running leg, the ITB syndrome. We're treating sartorius. We're treating fiber damage, muscle damage in the calf. How many injuries we can treat at the same time? You can do one by one, or you can do several at the same time, which is amazing. Here is more like, if you say like a healing protocol, this problem is not so big as it was in this, because he probably compensated with his leg because this was so bad for a long time. And then I just decided to do a little bit like a healing protocol, but still anti-inflammatory to prevent it getting worse, but at the same time, increase the blood flow, increase the resources so the patient can get a good long-term result. And this works for 3 days. After 3 days, the patient comes back. And if he's better, we increase the strength of the devices or change the protocol. And this treatment for these kind of problems can take everything from 2 weeks to 6 months, depend if the patient do what we tell them. Normally, injury like this goes quite fast. Very rare that it's more than 1 month. So thank you for coming, Napoleon. And it's amazing, huh? You shower, everything is normal.
Do you have to remove this? No.
No.
Just leave this.
Leave them for 3 days.
Ah, okay.
Yeah. If you remove them, it's not a good idea.
Yeah. So I leave them for 3 days.
Yes. Yeah. And we will give you some appointments to come back and follow up on this.
Okay.
So thank you for coming here and
welcome and
voluntarily take the pain.
That really hurts. Really.
Yeah, no, it was really bad.
But it's it's good that you were able to find the source.
Yeah.
Pain is.
Yeah. No, for you, it's really painful and it affected your whole leg. So when you come next time, we will check everything for you.
Yeah,
so,
it affects my mobility, and especially when I want to exercise and do some brisk walking.
Yeah.
I got tired for 20 minutes, so I have to sit again and then go.
Yeah. But the important now is that you drink a lot of, like half liter of water per hour, but not fast, little by little. Okay. The more hydrated you are, the better this works. But be careful, because soon after now, I check you again after seconds, but the longer time it goes, the less pain you will feel. It means don't run up for La Concha. Take it easy.
Yeah.
I will. Yeah. I've seen that before. No pain, and then they go running and do everything.
Yeah.
So
Thank you very much.
you're welcome, sir. Welcome. Thank you very much.
Wow. Feel good.
It's nice, huh?
Yeah.
Yeah, it's many that comes here and get shot.
Oh, it's done.
Yeah.
Yeah, I have applied cream, some plasters, and yeah, and nothing's changed.
No.
I just go on,
Yeah.
just superficial.
Yeah. And now you feel the difference, huh?
Yeah. Like, so wonder, I'm feel strange now.
Yeah. It's weird, yeah? Yeah.
Thank
No,
you very
it will
much.
be good. Thank you
very much.
Napoleon. Thank
Oh,
you very much.
I'm going.
That's okay. So we see how it's going on in the rest of the day.
Yeah.
Thank you very
Thank you very much.
much.
Thank you very much, Doctor. Thank you.
So guys, I think it's getting more evident that you need this as a tool in your clinic, right? In this case, Dr. Miguel decided to create many small protocols approaching different injuries in the same joint, and also he did it the other knee as well. This is because with the ANF devices, you can approach many different injuries at the same time. The devices do not conflict with each other. So if you have a patient with a knee injury together with the same hip or the contralateral hip or the same ankle, you can treat any of those injuries at the same time in the same visit. All right, next we have another patient also with knee issues. Let's see what Dr. Miguel will find out and how we can help her. Hello, Maria Jose. Welcome to the ANF clinic. Thank you. Please have a seat. Let me put the microphone and please let us know a little bit about what you're doing in your, if you do any sports, if you have any issues, and
yeah. Well, I usually go to the gym 3-4 times a week, and in this knee, I feel like I have pain here. When I do my exercise for legs, after that, I feel that the knee is not okay. No, full okay.
Okay.
Do I have to remove my shoes?
No, you don't. Okay. If you lie up, please. So this patient complained about lateral side pain that can be many different things. It can be ITB syndrome. It can be the hip issue. It can be many things. It can also be the doctors that contract like this when she's exercising. So we will try to figure out what's going on here and see how we can treat that differently from the other tools. One thing that we also always check, of course, is the length of the legs, if they are the same or not. And here it's quite obvious what her problem is because she actually rotates internally with both knees. So when she exercises, it will probably be the same. So here, I will start to give you lie down, please. The examination can be painful, but I will remove the pain.
Okay.
So I will start, because of a complaint, up over the hip and trochanter area here in the pelvis.
Yeah.
So here, it's inflammation here. I will follow down, going down to the ITB here. Yeah, and here it comes. So now when I go below the ITB band here and into the thigh to find a nerve, and now you can see what happens when she trains and she gets tired in her legs, she rotates. So we can actually simulate the injury she has and the problems she has, and in this way find out what treatment I need to do. So I continue here. Yeah. So definitely ITB syndrome. We go to the end of the tendon here. And because she's a nice woman, I'm very gentle. So, and we can also see here she have a little bit of spider net formation on her skin. This is indication of chronic inflammation. When the blood cannot flow normally, it finds its own way to move around. With this problem, she probably also have issues in adductors. We check sartorius first. So every patient, no matter what, we check everything very, very detailed because it's really important. The pads, patella tendon, move the patella, put pressure on, there's no pain, which is good. If it would be a chronic knee pain, she would feel pain during this examination. The joint line. And also here, the medial hamstring. That means I will also find for sure in the adductors. So we go in between. You can see how easy it is to come in between the muscles. And here comes the pain. She's very happy. Not so happy.
Oh.
Definitely not happy. We go here, put pressure on the adductors into the here and put down. So this is just nice and easy. Okay. If you go on your stomach, please. And we can see the circulation issues. So just to be sure, just see so we don't have any issues with the meniscus or anything. A little bit too much rotation here. And as you remember, I find something here on the hamstring here. Yeah, for sure. We checked also the lymph here. Lateral side. Okay, so we will create a different protocol here. We will try to do the adductors here. We will go the ITB and the blood flow and circulation. If you go on the back again, please. You bend the knee and make like this a little bit here. So we're going to isolate our adductors here because this, of course, when you do like this, create a lot of problems. We use the same devices. We use the low frequencies just to show you. I can guarantee you 70% or 80% of our knee patients and hip patients is the adductors. But it's actually, this is the only thing that can remove that problem. So we put it on the side here of the adductors. That's the positive, 1, 2. And then it's very important when you place the negative, don't go all the way to the knee. In the middle part here, because here in between is actually creating the problem. Here is not so much pressure. You will see when I check this again, it will not be so painful as before, because you need to understand how the different nerve is branching out and what is doing what. I will use remove the free radicals again, the problem that create the problem. I put one here. I need to use the carnosine. I put one here to renew the tissue cells. And already now it's better.
Yeah.
Yeah.
Okay.
Something like this. Here on ITB, I need to do a different. Can you lie on this side, please? So I want to increase the movement of iliofemoral band. At the same time, I want to do anti-inflammatory. So we're going to use energy. Right. So I'm going to put the positive energy here. I'll use the negative. And this one, I actually go all the way to where it ends. Because they can work the whole body or they can work shortly. But this because I want to extend this, because the energy device can extend the movement of any muscle or tendon up to 53%. So we release the pressure here. Then I will use the anti-inflammatory. I can do this advanced or I can do it simple. I decide now to do it somewhere in between. I just throw this up. I put the positive here. So I'm just going to do a little bit of a zigzag pattern here. And it's important you end the positive anti-inflammatory over the energy, right? And we put the negative here, here, and of course here. We use the antioxidants. We're going to put here. Here is more pressure, of course. So we're going to have the glutathione here and the calcium here. So renewing cell, remove free radicals. Lie on your back again, please. Okay. I'm going to go under the ITB again to put pressure on the same nerve and see what happens, but 100% more pressure because I really want to irritate it now and get confirmation it's getting better. How does it feel now?
Much better.
No screaming anymore?
I feel pain, but
not as before?
Not as before.
So now I'm checking just for details because I had the hamstring issue here. Yeah. So this one I need to remove here. You have the positive, please, and negative. So we have 1, 2 really chronic problems. Now I'm going to take the hamstring here and also a bit of sartorius at the same time. 2 positives. And we're going to use the negative up here. And 1 negative right up here. And all of these can also work with the one up here. It's no problem. I will use here glutathione. And now I choose to remove the free radicals and also one to remove the stress, because this is created because of the other 2 that this is trying to compensate. So when she train a lot, 3 times a week, with all these rotations, all of these get overused. So we remove the stress here as well. And then we check.
Much better.
Different?
Yes.
And the resistance here now is a lot less than before. So what we show you here today is 3 or 4 different ways how to treat knee problems. 3 or 4 different ways what could be the source. It can also be the hip, it can be the lower back, it can even be stomach issues because it's the same nerve system. We need to understand the nerve system is a closed system. Everything negative that goes on anywhere in the body will spread all over the system. One day, sooner or later, it will affect us as humans, no matter what. So now I'm controlling this ITB again. And I really provocate it now, even if I use very low frequency. What I want to feel is less tension, that is less stressed and softer and not hard and painful. And this. And also the angle of the leg is different. It's not so over-rotated as before. Even if I put pressure on the nerve here, the leg is relaxed, which is really important. And the adductors here go in between. I always locate the main nerve here and the branches on the femoral nerve. And if they lie relaxed as you do now, it's good. Believe me, I can't find anything. See it, stand up and see how it feels in your leg.
Better.
Maybe do a squat, stand to, you see how the right leg is want to rotate, but the left doesn't do it anymore, which is really important.
And I used to feel pain here when I used to that. And now.
Weird. Yeah. So this is also very common for football players, ice hockey player, runners, adductors, ITB. And you can also see how edema removes from the adductor area. You can see where the disc is sitting, that you get this crater in the tissue. So it means you had the problem for quite some time, for sure. But we will make sure you come back and fix this permanently.
Okay.
I hope you enjoyed this session. I did, and we have a lot more to show you in the future with different topics, how to treat different problems. And I guarantee for all of you, this will change everything in your clinic. Not only for you, your personal knowledge and the personal understanding of neurological and biochemical function of the body and the frequency medicine, but also for the status of your clinic. And most of all important, for your patient. This is another tool with all the tools you have that can make life even better for your patients. Thank you for watching, and I think Tia or Irina will talk to you now.
Well, in this third case, Dr. Mikkel approached also the root cause of the problem, which was not exactly on the knee. He went all the way up to the hip to apply the ANF devices, because the ANF devices is not pain relief. As you could see, very good pain alleviation, of course. This is the main biggest benefit, but the ANF devices target the root cause of the problems to normalize the neurological frequencies. Today, you got familiar with P200, P-9, AGL, ACA, which is glutathione and carnosine frequencies, and MC. Guess what? These are included in the first level of education. So our colleagues will help you how to join ANF Academy courses. Thank you very much for watching.
Hello everyone, Irina, thank you. I think we all enjoyed. I don't think our patients enjoyed the examination part. You could see that was painful, but it's part of the treatment. It's part of, we teach our therapists how to perform neurological examination to find the root cause of patient's problem, because we don't want to treat their symptoms. But if you have questions on how to enroll into our education, if you haven't seen yet, we are currently running seasonal offer. So I would like Dr. Zedan to show you our offer and walk you through it, because we have 3 different offers.
Okay, thank you for coming today. I will share my screen. Do you see my screen here right now?
Yes, I see. Can someone else confirm of the attendees? Can you see the screen?
Okay, amazing. So, okay, I want to explain that we have like our courses, or the course structure consists of 3 parts. We have Module A, Module B, and Module C. It's all of them is 8 level of knowledge, and after this we have final exam, and after this you be ANF certified practitioner worldwide. So regarding the Module A, we have Module A, Module B, and Module C. Module A consists of 3 parts, 1, 2, and 3. Module B, 4, 5, and 6. And the last part is 7, 8, and the final exam. Module C is the intensive practical part that usually the therapists came to our head office in Marbella, Spain, and we have Module A and B. It's online. You can take it in any place, in any country you have. So let's go to we have a spring offer. Our spring offer. Yeah.
I would like just to say one thing so they don't get confused. You can already apply ANF therapy during the first course, because once you make a first order, we will send you a tester package also for free. So during the theoretical part, you can apply devices on yourself, on your patients, because there are no side effects. And you will get theoretical part and experience at the same time. So you can use devices already within the first level of education.
That's right. Thank you, Tia. And we have, like, as I told you, we have module A and B and C. Module A consists of 3 parts, AP1, AP2, and AP3. And here is what you will learn during AP1. AP1 is interactive 9 classes, and we have exam and case studies that you will use these devices that we will send you, and you can complete these cases. And we have AP2 that you will learn chronic injuries, muscle generation, recovery, and the performance. And it consists of 6 interactive classes. And AP3, you can learn here that we have like practicals, and you will learn inflammation, tissue healing, tissue remodeling, and maintenance. So regarding the offer, we have the module A that I told you that it consists of 3 parts, module 1, 2, and 3. You can get it right now with offer at $899 instead of 1,200. We have another option that you can take only the first level of module A, it's AP1, with 140 devices with 400 euro. So module A is 899, it's including 140 devices. Or only the first level with 400 euro with 140 devices. And we have another option that you can figure out the courses and figure out the interactive classes without any devices with only 99 euro. Please that we have the next AP1 level will be in April. It starts from 9 to 11 of April. So we have a limited number of practitioners. So like hurry up to sign up for this level. And please see us send them the link for the spring offers that you can send them in. We have your emails and we can put it in the chat below. So thank you very much.
Can we just, Zedan,
yes, go.
Can we just clarify how the course looks like? So
yeah.
once you get enrolled in AP1 and you are done with onboarding process, you will attend. You will get access to our e-learning platform where you're gonna see lots of reading material, lots of presentations. You're gonna see lots of videos that you have to go through. You will attend 3 days, 3 hours each, Zoom class with one of our master instructors. After that, you're gonna have 2 assignments that you have to apply the protocols. You will see, you will get to know more. If you want to book a call with us and get more information, you're always welcome. Zedan, please, can you share a link for booking a call with us? So after the class, you will need to go through all learning material, because after the assignments, there is a short exam. You will get a certificate after each level of education. So first, within each level, you will be introduced to new NF devices. So you start with the level 1. When you're done with level 1, you proceed level 2, 3, 4, and so on. If you have any questions right now, you can ask in the chat. If not, I want to tell you that the recording of this event will be sent to your email together with the link. You can also pass the link to this offer in the chat, Zedan, if you can. But we will send you a link to the offer together with the recording tomorrow afternoon. I think we covered it all. If you have questions, now is the time. If not, thank you for joining us today. I hope that you enjoyed the event and think that actually we had a team. So next time we will see, maybe we're gonna choose another team. It's not test patients, finding new patients that are actually willing to be treated on camera sometimes can be challenging, but for now we are lucky because all these patients are based in Marbella, and they heard from their families or relatives or friends who tried NF therapy and they were happy about it. No more questions? Thank you very much for joining us today. Thank you, Zedan, for being a host with me.
Thank you. Have a nice day, and we're welcoming you into NF Academy. See you soon.
See you soon. Bye-bye.
Bye.